Hi, my name is Ashley Palmer. I'm bringing to you the Advanced Directives case study for ethics class. All of my experiences in the ICU, in this setting there are a lot of ethical decisions that arise. A lot of them have to do with end-of-life treatment, and that involves questions about foregoing treatment, stopping and extubating a lot of the times, or continuing treatment. Power of attorneys have a big play in this. They deal with making decisions for a patient if they are unable, whether that be sedation or a level of consciousness issue due to a head injury. Medical power of attorneys can be next of kin a lot of times. If a patient has a husband or wife, it's oftentimes that person, or if they are not married, it's often the parents. The power of attorney can be appointed, and it can be somebody who's not even related, just as long as the patient has appointed that person to make their decisions. Code status is something that these people decide a lot. DNR, which is do not resuscitate, or DNI, which is do not intubate. A lot of the code status decisions have to do with that, or being a full code, which that means if the patient were to have a cardiac arrest, they would receive CPR, epinephrine, medications to keep the heart going, and things like intubation, breathing tube. Advanced directives, which is what a lot of this presentation deals with, is something that a legal document that somebody can delineate what they would like done in the event of cardiac arrest, respiratory arrest, or in the event that they have been under treatment for however long, and if they would like to receive things like tube feedings or large invasive surgeries. Nurse practitioners and physicians' role in this is often informing about prognosis, giving treatment options as to what can be done now, and then sometimes patients will ask about past experience, where you can talk about patients that you've had like this in the past, how they did, how well they did, how well they did not do. The case study for this presentation, I'm going to go ahead and read off of my paper. Sarah is a doctorate level nurse practitioner who has experience in the ICU and the ER. She currently works with trauma services and rounds on patients who are admitted with a trauma diagnosis. John is a 40-year-old male who was involved in a motor vehicle accident where he suffered spinal cord injuries, leaving him to be quadriplegic. He is currently ventilated and sedated, and his girlfriend, Susan, has been informed of the poor prognosis and of his quadriplegic status. Susan has expressed that he would want to live for his children and everything should be done. With no other family or power of attorney present, the medical team has honored her wishes, and John has been on life support for 2 days, and tube feedings have been started. When Sarah enters the room for her morning rounds, John's mother has arrived for the first time, without Susan present, and she is very emotionally upset. John's mother informs Sarah that John has a living will and doesn't want any of this. John's mother has a copy of that living will and brings it to Sarah. The living will shows that John has predetermined that he would not want to be on life support for any reason. John's mother informs Sarah that Susan is aware of his wishes and the existence of this living will. When Susan is confronted with the issue, she begins to cry and says, "I know about the living will, I just want him to be okay." Brings me to ethical principle. Autonomy is involved here. This ethical principle deals with the ability for individuals to self-determine their plan of care, plan of action, and respect to the liberty of the individual based on their values and beliefs. Within this situation, John's autonomy is being violated. He has predetermined and made a decision that if something like this were to ever happen, he does not want life-sustaining measures to be taken. So Susan has, at this point, ignored his wishes and violated his autonomy. The law. Federal law to deal with this situation has to do with the Patient Self-Determination Act. This requires providers to honor advanced directives such as a living will or a power of attorney. Within this situation, the medical team really doesn't actually have a choice but to treat John. Even though Susan is his girlfriend, she's not technically his power of attorney. They are obligated to treat until a decision maker has made a decision otherwise. Minnesota law specifies that if someone willfully conceals or withholds personal knowledge of a living will, she is guilty of a misdemeanor, and it can result in a felony if the act results in bodily harm. So the decision: the medical team consulted with the mother, and John's mother chose not to press any charges because Susan was acting out of emotion and John's wishes can still be carried out. John's autonomy can be protected through this decision because his wishes are being honored. He is able to be taken off life support, and no further bodily harm will be done. And John's mother chose not to take any legal action because she believes that Susan was acting out of emotional decisions. Legal reasoning. Susan is technically worthy of a misdemeanor. She has violated the law and withheld his advance directives. And this would not be a felony because there technically wasn't any harm done to John. The life-sustaining measures had already been done. He got in the car accident. He was intubated and brought to the hospital. Susan didn't make any decisions on any large invasive surgeries or procedures to bring him any further complications or issues. Legal reasoning involves things like coherence. That, in a couple words, is what is a justifiable decision. Are there any outside influences that affect this situation? And logic. Why would Susan make decisions like this? Does she have any financial gain involved? And does she like being in control? Things like that. Another thing within legal reasoning is case law. Terry Schiavo is a pretty famous case where she was in a vegetative state and had made decisions beforehand that if she were ever in a situation like this, she would not like to be kept alive. Her husband kept her alive, kept doing many treatments for a long period of time. To use case law within legal reasoning, you could look at what punishments or what determinations were made in cases like that and compare it to this one. While that situation is more severe, longer periods of time, more treatments involved, you could use that in the legal reasoning and helping to decide what course of action needs to be taken. Ethical reasoning. Judging the rightness or wrongness of moral issues is essentially what legal reasoning is. Like I was talking about with those examples before, the moral issues that were violated in Susan's case are bad. It is bad that she violated his autonomy and allowed for life support to keep going, but it would be worse if she were to keep withholding this living will more than just 2 days. The ethical elements within this situation are beneficence, which is promoting one's welfare, and autonomy, which is essentially respecting one's decision-making right. It was not promoting John's welfare that Susan allowed for his wishes not to be met, which also brings in the autonomy. His beneficence could have been violated further if she were to allow further treatment, further procedures to take place without giving information about his living will. And logic, what elements are weighing in on this situation? As far as emotions, it was a new tragedy that John got in this motor vehicle accident. Is she in shock? Is she just not accepting the situation currently? Is she not ready to let go, to withdraw treatment? Some advantages within ethical reasoning involve discussion. Things like this, we can talk about what Susan's point of view may be, the kind of take into account the situation of the whole thing. There are kids involved. Does she want to allow them to help make the decision? Does she want to allow them to come see him, have time to grieve? And then disadvantages are that sometimes pseudo-ethics can be involved, and that those are religion and social customs or traditions. Just kind of an example to bring in the pseudo-ethics: if a patient has a GI bleed, there are some ethical beliefs that you can't receive blood transfusions in certain religions. Those people have to decide if they want that to happen, and that can result in death. And then in conclusion, ethical decisions can be frequent, especially for nurse practitioners, because they often look at the whole picture and help explain things for family members. And this can happen in almost any setting. I talked about how it often happens within the ICU, and it can happen in the ER as well if a patient comes and there are decisions involved and no family members present. It can be questionable whether it's appropriate to maybe keep going with treatment or to not. And in the NICU, there's a lot of times where infants are kept alive with a very poor prognosis or chance of life off of life support. And in oncology happens as well. There's oftentimes question whether chemo and radiation treatments are worth it for quality of life. Does the patient really want this? Those are times when it's very important for them to have advanced directives in the event that the decision would come about whether to keep going or not. Nurse practitioners need to be aware of this and involve legal and ethical reasoning in their decisions, and help families reach appropriate decisions with taking everything into account and making appropriate decisions. With this presentation, I'm going to submit my paper. All the information involved in this presentation is also referenced on my reference page within my paper. Thank you for listening. Hope everybody has a good rest of the term. Thanks.